You're watching News 8's Good Morning Connecticut.
Well, coming up next here on Good Morning Connecticut, setting up a safe room still ahead. Flu season is here, and many times people get sick from catching the flu by those closest to us, like family and friends. And just ahead, a family physician is here explaining what a, quote, safe room is and the key things every safe room must have. Well, it happens every year at this time. People start with the sniffles, and before they know, they have the cold, they've got body aches, and oftentimes it's the flu, and family members are often the culprits. Now, kids come home from school, parents from work, and they spread it to each other back and forth, a repeated pattern. Unless you create a safe room, according to Dr. Steve Schwartz, who is a family physician. He's been one for more than 25 years. Good morning, Dr. Schwartz.
Good morning.
Nice to have you here. First off, what is a safe room?
Well, every parent's had the experience of their child coming home from school sick, and what do you do?
Right.
And 3 to 4 days, the rest of the family's sick. That happens 2, 3, 4 times a year. It gets really tiresome.
That's for sure.
So the safe room is a way to prevent that.
Okay, so what is the safe room?
The safe room is a system. It's layered technology. It uses best practices. And it's a way to stop the spread of the virus and contain the infection.
So what do you when you're talking about layered technology, what does that mean?
Well, a layer is, let's say one layer would be gloves and mask. Another layer would be isolation, so putting somebody into the room itself, kind of following the 6-foot rule, making sure that they stay 6 feet away from other family members.
6 feet, is that how far the flu can spread even if you're not, necessarily touching them in terms of being airborne?
Yes, exactly. So if you have a cough, it releases small little aerosolized, particles with virus in it. If you have a sneeze, that's the most contagious. It has little larger particles. But they generally will settle out, and usually by about 6 feet, they settle out, and so it's a lot safer than being very close.
So you recommend designating one room in your house to being a quote-unquote safe room, right?
Yes.
And what are those items in the safe room? I mean, you talked about the layered technology like the masks and gloves, but then what else is in there?
Well, you need to have wipes that are laboratory tested that says that they kill flu viruses and cold viruses. You need to have a thermometer. You should have some Flunata. This is an interesting product. It's a nose and throat spray. It has been laboratory tested against 9 common cold and flu viruses. And then you need your masks and your gloves, both of which have been tested. And
goggles. I'm surprised to see the goggles. Are these really necessary?
Well, again, this is one of the layers, so you don't have to use it, but there is some research that shows even when you use the N95 mask, the flu virus can actually enter through the eye.
Wow.
So it goes into the eye, it goes into a little duct, and then it goes into the nasopharyngeal cavity.
I did not realize that.
Yeah, so if you have something to block droplets or even goggles, you can even have more protection.
Wow. So what is this? What is
this
contraption here?
This is actually a diffuser.
Okay.
We didn't have time to set it up before we came, but this offers humidity. So it helps the mucous membranes, it helps the mucus clearance, and you can put essential oils in it as well. Makes the room smell nice. It feels like you're doing something. Eucalyptus is really good.
And I take it you would recommend maybe a area that has a bathroom and a bedroom attached to it, right? Because I feel like you would need both areas to really try and quarantine the flu.
Yes, typically your guest bedroom is fine. Any bedroom with an adjacent bathroom is really what you want. The nice thing about the safe room is it's flexible. So you can use a different bedroom for different members of the household that are sick. Obviously, if it's the father, he's not going to want to be in the child's bedroom. So it all starts with a clear plastic tote. It's very portable, and you set it up in the room that's designated as a safe room for that person.
It's almost like you create a little hospital right in your own house.
Well, you really do. We're using some of the techniques from isolation rooms, and now all that technology to contain infection is affordable and it's inexpensive.
Great information. Thank you so much, Dr. Schwartz. And even if you don't have the space for a safe room, you can still use some of these practices even in your own house. I mean, in terms of preventing the spread of it.
That's exactly right.
Yeah.
If you don't have a room, they could be in the corner of one room, and you just use the 6-foot rule and make sure you stay 6 feet away, and just use common sense and look at the layers. But there's something in this for everybody.
Right, right. Well, it does cut down on the hugging, though, unfortunately.
Yes, it does.
Thank you, Dr. Schwartz. So for more information, you can always head to our website, WTNH.com. Just click on that on-air tab and pull it down to the Good Morning Connecticut Weekend section.